Hello, my name is Dr. Rekkas. I'm a board-certified bariatric surgeon, and I want to talk today about staples. A lot of people ask, how on earth do we do a sleeve gastrectomy or a gastric bypass? How do we staple the stomach? So what a better way to explain it than to show it. So behind me I actually have a Surefire stapler, and this is a staple device that actually goes into the robot that gets used for our cases, and let's show you how it works. So this is the actual stapling device, and it's a pretty amazing tool. If you look carefully at it here, you see a pair of jaws, and these jaws really help surgeons position the stapler, because not only do they open up and we can actually load a set of staple cartridges in here. Staples are loaded here in the instrument. They lock in. And if you look closely, you can see several rows here, and within these rows are titanium staples. On the bottom half of this is kind of like an anvil, and what happens is, using the help of the robot, these staples will go on, they will fire, they will lock in place, and their knife that comes in between will separate the two edges of the tissue to allow us to do surgery. What's really neat about these intuitive staplers are they actually have 120 degrees of articulation, so when we're trying to operate, the staple can get positioned in many different positions that may be necessary, and really it's a very effective tool. To show you a little bit more how these work, you can see here that as the stapler is actually firing, there is a bar that pushes all these small little titanium staples, and they kind of lock in place. And what we find is we have very good what we call hemostasis. The tissue is sealed, and there's a blade that comes in after the staples that separates the 6 rows of staples into 3 rows. And the other really neat thing about this tissue sensing technology that Intuitive has is it actually senses about 1,000 times a second whether or not that tissue is too thick or appropriate for the stapler to do its job. We get a lot of different questions about the staplers from patients. They wonder if they'll set off metal detectors, will they rust, will they go away. The staples are permanent, but if you look real carefully, actually these staples are very small, and they're almost about the size of a strand of hair. So these staples are very small. They won't set off metal detectors. They won't interfere with MRIs. They're very low reactivity, and they're made of titanium, which is a very durable metal that does not cause a lot of reaction in patients. And if you ever wondered how we do a sleeve gastrectomy, for example, how the staples get fired, these are one of the many robotic tools that we have that actually go in and help staple the stomach and do it safely so we can provide good care for our patients. Thanks for watching.